is over childhood leukemia. The pathophysiology, there's immature white blood cells that are produced by stem cells in bone marrow that mutate and clone themselves rapidly. They multiply rapidly instead of going through mitosis. And then the bone marrow fills with abnormal white blood cells, and then they leak into circulation and gradually replace normal white blood cells, and they don't act normally, so it causes all sorts of problems. And they're called leukemic clones, and they reduce red blood cells, platelets, and other blood products, leading to anemia and abnormal bleeding. So the cause isn't really known for leukemia, and it accounts for about 28% of all childhood cancer diagnoses. The risk factors include environmental factors like smoking, benzene and cigarette smoke, and gasoline, and genetic factors such as children with immunodeficiencies, a personal history of cancer, chromosomal defects, and exposure to chemotherapy and high doses of radiation. So there's a few types of leukemia, and the ones that I have starred are typically seen more often in children than the other ones. And the ones that are most often seen in children are acute lymphocytic leukemia, acute myeloid leukemia, and the rare ones are mixed phenotype acute leukemias, or MPALs, chronic myeloid leukemia, or CML, chronic lymphocytic leukemia, or CLL, which is extremely rare, and juvenile myelomonocytic leukemia, or JMML. So acute lymphocytic or lymphoblastic leukemia comes from immature lymphocytes, and it accounts for about 3 out of the 4 childhood leukemias, and it's mostly seen in children under 5. Signs and symptoms are weakness, decreased energy, recurrent infections, bleeding, pallor, bone pain, weight loss, sore throat, night sweats. Has about a 91% survival rate if caught in time. And then there's acute myeloid leukemia. It comes from myoblasts multiplying uncontrollably, and it causes hyperplasia of the bone marrow and spleen. And then it accounts for about the remaining cases of childhood leukemia, and it's most common seen in infancy to a year old, and then it increases again in adolescence. The signs and symptoms are fatigue, weakness, fever, anemia, headache, bone and joint pain, abnormal bleeding and bruising, recurrent infections, lymphadenopathy, splenomegaly, and hepatomegaly. And there's about a 66% survival rate for acute myeloid leukemia. Some of the diagnostic tests and procedures, so CBC with differential, they'll do a platelet count, a bone marrow exam, and then for surgery, they could get a bone marrow transplant, either allogenic or from a donor bone marrow, or autologous from the patient's own bone marrow when they are in remission. And then an alternative to bone marrow transplant would be stem cell transplant, and that's only from a donor. And then these are some of the diagnostic findings that you can find by type of leukemia. The treatment for these leukemias would be chemotherapy, targeted therapy, biological therapy, and radiation therapy. And the exam question that I had, what are the most common signs and symptoms of leukemia related to bone marrow involvement? A, petechia, fever, and fatigue. B, headache, papilledema, or irritability. C, muscle wasting, weight loss and fatigue. Or D, a decreased intracranial pressure, psychosis, and confusion. The answer is A. And the reason that the answer is A is because signs of infiltration of bone marrow are petechia from a low platelet count, fever related to infection from the lower number of effective leukocytes, because they've been taken over by those immature white blood cells, and fatigue from anemia, since there's a lower red blood cells from the immature white blood cells taken over. And those are my references.